Hello to all of you. So, let us discuss the vertebral levels today. I've received a lot of queries regarding the vertebral levels that, ma'am, if you can write all the vertebrals level together so it becomes easier for us to memorize it. So, today we will discuss it because we know vertebral levels is a very, very important question. And we always expect one or two questions from vertebral levels. So, we will be going in order. First of all, we will memorize the cervical level. We know the vertebral level means that the correspondence to the vertebral column. So first of all, we will memorize cervical, then thoracic, and then the lumbar. So we will go in order. When I say cervical, so of course that means it is related to this neck area. And when you see junction of C3 and C4, so we say it corresponds to upper border of thyroid cartilage, and at the same level you have carotid artery, common carotid artery bifurcation. Then slightly if you see at the C3 level over here only, at this level hide bone is present, and when you come towards the lower side, C6, a lot of events are happening over here. First of all, lower border of cricoid cartilage, very important landmark. At this level, common carotid artery pulsation, and that tubercle is carotid tubercle or Kazanec tubercle. At the same level, larynx and pharynx ends and the trachea and esophagus begins. So like all these landmarks are where towards the neck area. And in all these points also, the most important point is, first of all, you should be able to tell these blue colored areas. Junction of C3 C4 corresponds to upper border of thyroid cartilage. The C3 C4 is on the upper side. So which cartilage we choose? Thyroid, which is on the upper side. And upper, I'm saying everything upper. So upper border of thyroid cartilage. When I say C6, you say it is towards the lower side. So lower cartilage is cricoid cartilage, and if I see lower side, so it is the lower border of cricoid cartilage. These 2 points are very important. Then this one, common carotid artery pulsation, carotid tubercle C6. This is another very, very important point over here. So all these in the neck area. So all the vertebral level C. And now we will come to thorax area. In the thorax area, what are the vertebral levels or are T? In the thoracic level segments, in the thoracic vertebral levels, one is the scapula. In the scapula, you can see that inferior angle of scapula is at the level of T7. What are the other things? Superior angle, then you are having the spine of scapula. So you can see there are 3 levels for scapula. It is 2, 3, 7. For the scapula, 2, 3, 7 from above to below. So superior angle, spine, inferior angle. This is for the scapula. Then T4. The T4 is very, very important vertebral level, which is for sternal angle of Lewis. What is the complete name? Sternal angle of Lewis in the sternum. This is at what level? T4. Specifically lower border of T4. Okay, lower border of T4. So when you say na sternal angle of Lewis, you are saying Lewis. Lewis, and by this you remember lower. Lewis, lower border of T4. So this is another level which is very, very important. So these 2 are very, very important to memorize. And now, if you see other levels, so on the lower side, you are having T8, T10, T12. What are these? These are the levels of major openings of diaphragm. And we remember like this, VOA, 8, 10, 12. So V at the T8, esophagus at the level of T10, A for aortic at the level of T12. So all these are the thoracic segments. First we memorized for scapula, then in the sternum, sternal angle, and then for the diaphragm, VOA, 8, 10, 12. If you memorize like this in small components, you will be able to memorize it in a better way. So this is done for thorax region. Now let us come to abdomen area. Now in the abdominal area, of course, the lumbar vertebrae will start. So first of all, at the junction of T12, L1, celiac trunk origin, and then I have like together written over here what are the events occurring at L1, what is happening at L3, then L4, and then the L5, and finally at the S2. Now these are all written together over here, but whenever we are memorizing these lower segments, I will recommend you, first of all, you memorize what? First of all, you memorize the abdominal planes. Very, very important. These are very, very important. And how you are going to memorize, you can see already I have written over here 1, 3, 4, 5. So for the abdominal planes, you just remember 1, 3, 4, 5, 1, 3, 4, 5. And in this, the odd numbers 3 and 5 are what? 3 and 5, these are the vertebral levels for the subcostal plane and transtubercular plane, which are the planes for abdominal quadrants. Whenever you are talking about the division of abdominal quadrants, in that the planes are subcostal and transtubercular. So these are odd numbers. So 1, 3, 4, 5, and you remember 3 and 5 are for quadrants. Subcostal and transtubercular plane, L3 and L5. And both of them, they are upper border. Okay, so first of all, we memorize these. These are upper border. After that, we are having 1 and 4. These are the other levels, other planes over here. Transpyloric, and this is the supracrystal. Transpyloric at the level of L1, and L4 is supracrystal, which is at the level of highest point of iliac crest. Both of them, both of these other planes are what? For this, now we say it is lower border. So quadrants planes, both of them upper border, and the other two planes which we are memorizing is lower border. And now, like you may say, ma'am, what is this new planes, transpyloric and supracrystal? For this also, I will tell you a trick to memorize. Pylorus, transpyloric. Crystal is crest. It is passing through the highest point of iliac crest. So that is why crystal. If I say iliac crest, what is the location? Of course, you will say it is towards the lower side. So that means L4 will be supracrystal. Pylorus, stomach is towards the upper side. So you remember that pyloric plane, transpyloric, will be at the upper level, L1. So in this way you can memorize. Supracrystal crest is towards the lower side over here, and pylorus is towards the upper side. So all these are abdominal planes. First of all, you memorize this. And over here in the abdomen itself, what do you have? Yes, umbilicus also. The vertebral level of umbilicus is what? It is L4. And when we are talking about this umbilicus vertebral level, L4, in this the border is upper border. So umbilicus, upper border of L4. So first you memorize these planes over here, very, very important. Then after that, yes, very important, you know very well, spinal cord ends at what level? So L1, in the adults L1, lower border, and in the newborns it is L3, upper border. When you talk about another thing in the neuro portion, subarachnoid space ends at what level? S2. It is the lower border. When you are talking about the newborns, for this we say it is the upper border, and the others are lower border. So for the kids we are saying it is the upper border. So first you memorize in the lower segments, in the lower vertebral levels, we are first of all memorizing the abdominal planes, then the spinal cord. These are the ones which are very frequently asked. And now let us come back over here again. In this, other additional are, for the artery origin, the celiac trunk arises at T12 and L1 junction. Superior mesenteric artery arises at L1. Inferior mesenteric artery arises at the level of L3. Right? Then as we are talking about veins, portal vein formation at the level of L1, and very, very important over here, what? Abdominal aorta termination. It is at the level of L4, and IVC formation, it is at the level of what? L5. In this, like if you say that these are the some new points which were mentioned over here, in these new points, these two new points are very important, which can come as a question. Abdominal aorta termination L5 and IVC formation abdominal aorta termination L4 and IVC termination at L5. Another level you can see, we have written PSIS, it is posterior superior iliac spine. And very simple trick to memorize it is, if you say S, how many times S is there? You will say, ma'am, 2 times S. So S2. The level is S2. So S2 for PSIS. So all these are the vertebral levels which we have mentioned together. And for the lower levels, abdominal levels, first of all we memorize abdominal planes and then the spinal cord. So this is about the vertebral levels. So best wishes to all of you, and I wish that you do all the vertebral level questions correctly. So best wishes.